you there?
Yes, can you hear me?
Yes, Stefan. So
Hey,
what
Amanda.
we're talking about, lovely. You might need to turn your volume up a little bit, I think. But Stefan,
I'll do
we are
see what
now
I
on
can
the
do.
next bit, guys, talking about creating patient support groups. We've talked about the importance of the medical side, but the psychosocial aspect and how can we meet the needs of patients? How do we know what's going on? And also, what are their needs? Isn't always what we think is this is what they need. This is all the information they need. The patients don't always need that. And it's about how can we support patients and how can we build these relationships up? But bearing in mind we have got such limited resources and it's trying to be innovative in the way we work. Would you say that's fair, Stefan? So Stefan is a fabulous father. His family is
Thank
amazing,
you.
but all our families are amazing. We thought we'd do Stefan. I was going to just say a few words about how we've set up a national support group and how what the feedback was from that meeting, just some minutes. And then I think it will be relatable to everybody else. And then Heather, who runs a national patient support group, will also say a few words at the end. But I think the patient voice is really keen. Stefan, all over to you.
Okay, thank you. I hope I'll be saying the right things here. But yes, as you said, I'm here to talk about family support group and let me see my experience from the support we've had and how it has worked for me and how others have appreciated. And I'll put in the first word to say I'm not 100% sure what fits in the family support group and what is just support. So um, excuse me if I'll say a few other things. So what has worked for us is it really goes through the whole story of Matty's being born with a diagnosis at 5 days old and so on. So we're in for this journey. We're in for the transition. And the first support group we had was, I think it was only 5 months or maybe a year. And there was a meeting where well, there was meeting other parents. And there were cake there and so on. Okay, that was fine. But it didn't think that much of it. But the reason I'm mentioning it is because later it actually became quite apparent that these support groups and so on do more than I think at the time. So anyway, cutting a long story short, Matty's kidneys failed. It was around nearly 2 years ago now, and we started dialysis. And during that time is when we started to see more of the support and the support groups. So a WhatsApp group was set up for dialysis parents at that time. And I am not the biggest WhatsApp user. So I'm not the one who throws out exactly what I'm feeling and what I'm having for dinner at that time. But it's nice to see really what's out there and what's going on. So anything from other people having issues to when you turn up to the ward. Actually, it's happened a little bit more later in my experience of the ward situation. So what should I say? Oh yeah, so in this time really to make it relevant, Matty did have his transplant around a year ago, end of October, and we had quite a few complications afterwards, and that was the time when we got thrown into hospital without much notice. So, and that's when I noticed that the support group and specifically WhatsApp was more important than I thought. Partly because when you arrive at the ward, sometimes, and this was during COVID as well, and COVID aftermath, so sometimes you're very isolated, sometimes you're actually in an isolation room, and it can feel quite alone. But you see then on the WhatsApp group, either that other people or now starting to become a bit more friends are there, or just to send out a message saying, oh yeah, this happened to us, and people say, oh yeah, so and so is on the ward, and that's now starts to help a bit when you're there, because when you're in hospital, it's not directly fun, and if you can, you go out to the parent room and grab a coffee or so on, And if you have that support group, you then have broken the ice with people who are in there. So sometimes it can be a bit awkward. But if you've already spoken to them, go say, oh yeah, you're the person who's so and so. And then you know a little bit more about them, and it's so much easier. And that could really change the day for when you're in the hospital. And it's a kind of knock-on effect that these support groups have got. WhatsApp group or these kind of meetups that's been at the time, going back to that first meeting when, what was it, 7 years ago now. So after this transplant, for example, we did manage to make it to the transplant games this summer with the Southampton team, which was brilliant. But once again, there we had a chance to make use of this this meetup, because suddenly we met some of the parents, and the children met each other as well, even though they were too little. But suddenly we met some of the parents that we've met 7 years ago, and it's so much easier to break the ice and start the conversations and so on. So what seemed like a small, not very significant meeting 7 years ago actually made the initial discussions and just to call it make friends with people in similar situations much easier. So that's really how I should say these support groups have helped. They could probably say the same thing if you've taken part in any other of activities that I saw in 2 calls earlier. I haven't been on this call all day, so excuse me if I've missed or repeating things. So yeah, the things that helped us and me is that knowing the support is there, and then hearing others in similar situations, and also just see that what you're going through might be a horrible time, but call it a setback, and that setback seems like the end of the world at the time. But to have people out there, maybe WhatsApp, maybe other meetups, that you can then talk about, okay, you've gone through this, it makes it feel a bit easier. And something that also makes it sound silly, that is that you make friends, and you realize that you're not alone. But maybe to finish on a very good example that comes more from my wife of experience here of these groups. So that is that we go down to clinic average once a week.
Oh, Stefan, you've just muted. So are you able to unmute yourself? Sorry, I don't know how that happened. Thank you.
I don't know that either. Oh, okay. Well, the last thing I wanted to say was that it does help, and it's continued to help now when mostly my wife, but me too, go down to clinic for the blood test average every week. And what used to be quite a tough time just to get our child into the car to go and have painful blood tests, it's now turning into a little bit more of a social event, because you start to know these people. So instead of sitting alone in a quiet room where no one talks to each other, it's becomes more fun. And also for the children, they know each other, they will play, and they will be less scared because they might know that, or they recognize people. So yeah, those are really the experience and the benefits I feel from the support groups. And if that fits into the category, I don't know, but
yeah, no,
that's what it does.
Do you know what, Stefan, it does? Because one of the things, and you remember, you weren't here earlier on the call, one of the things that it's been fantastic that and made such a difference to other patients was seeing Matty with his PD catheter running around. That made a huge difference, and you guys have been phenomenal on that. So you're making a big difference to the psychological well-being, and I think you forget about that. So we can never thank you enough for doing all that kind of stuff.
But it's also, he enjoyed that because
he loved it.
He likes helping others, at least the way we put it to him. So Please.
Stefan, I really want to thank you for that. And you know, it's really powerful what you say, and that feeling of of being alone, seeing other people going on, you know, seeing other people that are at different stages of the journey has been incredibly helpful for lots and lots of families. And that thing, the WhatsApp group is, and I'm just going to show some slides in a second just now, but that WhatsApp group and what you said about being admitted in the middle of the night, I've seen patients and parents, and you see it time and time again. They say not just in kidneys, but across the board and across the UK, that say, I feel incredibly alone when my child gets admitted. It is awful. But when I go on the group and I say I'm on, it's just wonderful having all these messages of support. And I think that's what you are echoing. And that is Echo, a really easy thing to set up. But what I'm going to do, if you're happy with this, I'm just going to share some slides about how the group was a little bit set up, talk about the first meeting, and Stefan, you were there, about the national virtual support group that we've done, so that it's not just us in Southampton. This is what we started in Southampton, and we're looking at how we can actually make sure there's no postcode lottery. And then I'm going to bring in Heather, who runs KDAR, just for a few words right at the end. I know we're running a little bit late, so I'm going to run into the coffee break, probably give people 5 minutes, and then they'll get back, and then we'll go back after the next talk. We will sort it out. Do not worry. We will not run too late. Dean, farewell. Okay. I don't know. Thank you. Okay. So let me just get this. I'm going to keep this bit really, really short. I've got one busy slide that I want to show, and then that's fine. Oops. Can you see that? Okay. Marvelous. Okay. So this is, so what the support group, the buddy up system, what we do at Southampton at the moment is, what we were doing years ago is, if a patient comes in with a long-term condition, chronic kidney disease, we will introduce them to another parent, which say, do you mind having a word with them, because it's overwhelming, and they value that. And I remember one mother saying, I am so jealous, because I'm happy to talk to that parent. I am so jealous that this wasn't available for me when I first started. So we can never thank her enough. And another one who's now wonderful and light, I said, it'd be lovely to have your voice. She goes, no, I've got nothing to add. She goes, I'm in a good place. She goes, but when I first started, I was in such a dark place. And I thought, but that is powerful in itself, saying you're starting in a dark place and you're going to somewhere positive. So we are making sure that we're trying to create these patient voices. So we say to patients, this is how people feel. Listen to this particular voice, or let's connect you. Some people don't want to connect. They'd rather watch a video. So from the dialysis choices pathway, you know, decision grid, where we had loads of families involved, one of the things that came out was, you know, we talked about the 10 steps to home, we talked about resources, but we talked about a patient support group, and we appointed a family therapist for this, because we had no family therapist at that time. But it was about how could we meet the needs of our patients with only a 3-day family therapist. So what they did was, we developed a support network. It was supposed to be not just dialysis, it's expanding to the larger chronic kidney diseases group, and we've got some that we know will need dialysis and transplantation in the next 5 to 10 years. So all these people are going to be in the same group. The reason being, they're at different stages of the journey, so there'll be lots of help. I wish I'd known this, so we can create that resource, or here's a golden tip for you. So they developed sorry, these are not my slides. These are my family therapist slides, who couldn't come today, so I apologize for that. So they set up a peer support network, which was great. And we've offered one-to-one support for some of the families, but they said they much prefer the group therapy. And with that, they developed resources. And I will show you a resource that we are going to be putting in all patient contact areas as well. And what it does is it also allows communication between the families and the medical team. And they meet monthly, one just to say how they're all getting on, but also to talk about topics that will be beneficial. And at the moment, you know, with the cost of living, benefits are very, very high on people's agenda and minds. So we also develop all signposter resources that are out there. So the way that so we did that in Southampton. It was very, very successful, actually, and the feedback was excellent. As Stefan attests to it, and as you can see, some of the resources that are being produced. But what we wanted to do was set something up nationally, because we know that patients nationally are struggling, and not everybody has access to a family therapist, to psychological support, or even a youth service. So we're doing this for the youth service too. And we've got outcome measures that we measure, because it's important that we do collect data. So there's a Warwick Edinburgh Wellbeing Score, which is nationally and internationally validated. We've got some extra questions on there for the young people, but at least we can assess progress as they get on. They're developing resources. There's a session feedback form, and as we said, there's going to be a WhatsApp group. Oops, I've got that twice. I've no idea. Why would I not? So we had the first national meeting just about a month ago. Because of the shingles I had, guys, I have not sent out the minutes in case they're in the audience, but just to let you know, but I will show you what came up from the minutes. And what they all said was, actually, because this went to the patient group prior, so we had some resources for the first meeting. These were the things that we shared. And one of the things they said was, actually, it would be great to use the Hello to Children services for any parent whose child has been diagnosed with a long-term condition, because it gives them a framework, it gives them a voice, and they know that actually they're going to get that holistic package of care. And one of the first things that's said in this particular leaflet is, actually, when your child is diagnosed with a with a long-term condition, it can be overwhelming. Just acknowledging that, actually, even when it's a mild condition. I'm surprised, because I talk to my parents a lot. Even when it's a mild condition, you see their eyes well up, and you can just think, wow, it's so mild, I'm not even concerned. But to you, it was really hard. I'm sorry I didn't pick that up before. And you can get support in place for that. With the parent support groups at this particular meeting, we've only got 13 UK kidney units for children across the UK. The invitation was sent out to all, and we had some people, I think, from the 4 nations. The charity organizations, we got them involved, because this is a charity funded project at the moment, and I gave my time for free, and the parents and people came along, and the MDT joins as well, actually. And then there's the family therapist and the psychologist, and they were involved. So we're trying to get, and I'll show you what we're doing so that you do know. But basically, they said, let's use the the Hello to Children's as a framework for the sessions and support. Then you're providing psychological, then you're providing the holistic package of care, and you can develop those resources, just like the diabetes group did when they put that education package in place. And you start the parents on the program, and it gives them a voice. And remember, these are the key areas that we talk about, and certainly sex and intimacy can be talked about in here as well. Now, it's a very, very busy side, but I think the stuff that came out, and this is a 40-minute meeting. We had technical issues that day as well, but we won't go into that. But these are the things that came up from that day. And I think it's not unique to kidneys. It will be across the UK and across subspecialties. And there's some ideas in here that I think may be beneficial to the rest of the group and to the rest of the people on this talk, but also internationally as well, because I know we've got some international delegates too. Use the Hello program for a framework, and all patients should be started on it. So you can start empowering, and there's no confusion, and there's no postcode lottery. One of the things they also said was, actually, and we know this with our dialysis patients, is that some of them have a long-term chronic kidney disease. That's fine. Some of them are on dialysis, then they go on to transplantation. But you get different levels of support. And what we need to make sure is that, actually, and I was horrified that one of our patients hadn't had access to benefits for 18 months. They were filling in these forms themselves, didn't know what was available to them. And I was mortified. That is not the service that we want to be offering. So it's important that we have checklists. One, that the healthcare professionals can make sure that they're being signposted to all the resources. Then also making sure that the patients have it so they can ask for these. Because if they're empowered to ask for these and they know that they're entitled to these, it is much better. And that way, that would get rid of the postcode lottery. And this is what we're going to be doing nationally for our kidney population. But this is something that you can do with your own organizations. And what we're going to do is we're going to badge it Ready, Steady, Go tier, because it takes the politics out of it, and with our associations as well, and then for use abroad as well. We also talk about the benefits that they can be signposted to, the support groups, which I wasn't aware that it was only a dialysis support group, because the group was created for all patients with a long-term chronic kidney condition whose patients will eventually need a transplant in the future. So I was surprised that some patients weren't getting access to this support. And that is my fault, because I haven't checked in on that. And this is another thing, and Camilla Kingdom copied on this. I did not realize, and maybe you guys did, that you can get on an electricity priority list if you have children that are on medication that goes into the fridge, not the dialysis one, not special equipment, but if you've got children, maybe you all knew this, on medication that goes into the fridge, you get a priority list. So if the electricity goes down, you will be, you can phone them on an emergency number. I have spoken to numbers of colleagues across different subspecialties and across the UK did not know about it, which is gobsmacking. But this will then allow us to standardize practice and empower the MDT as well, but also the patient, and get rid of postcode lottery. The other thing that's really hard that they said, which is true, that some places, somebody's got chronic kidney disease and they're on dialysis, they get DLA, another place doesn't. So what we've asked the charities to do is fill in a standard template with what the issues are, so then we can cut and paste the relevant bits, which would make life so much easier, because those forms are overwhelming. I can't bear to think what these poor parents have to go to. And I hate filling forms because I know that. So that's one of the reasons I want to do it as well. And then we're also doing a directory of all the kidney patients associations that are out there. We weren't aware of that. And what we're also doing is getting a database of renal psychologists so that they can then give up, maybe once a month, I think, give up, or once every 2 months, or maybe once a year, give up their time to help support this group. And then also as a psychology group and the family therapy group, see how they can actually offer group support for these patients and develop those resources, just like the renal youth workers are doing. So hospitals and patients know where to go. Kidney Care UK is one of our richest kidney charities. We did not know this. They have 4 counsellors that can be accessed by patients, carers, and parents. So, you know what? Didn't know this. So if you haven't got the psychological support, see what your kidney charities have got, because if you say that there's a need for them, they may appoint them. Didn't know they had 16 advocacy officers that you can refer your parents to. And then they will then go and give a benefits calculator and refer on to agencies to support filling in of these benefits and see what benefits they're entitled to. And if people are interested, they go to a particular agency that looks at your, not just for kidneys, but they can do it for other specialties as well, that they can then see all the benefits you're entitled to. And that might be something that you guys might want to do. And if you're interested in that, do message and I will put you in contact with the Kidney Care, or I think it's somebody called Aruja, but I didn't check the spelling, so I can't do that. And what we're also going to do is at the next National Patient Conference, which is mainly adult-centered, they've agreed that the children, young persons and carer voices will be there. So it highlights the issues that our young people are facing, so they can get the relationships and shape the future, which is really important. And again, signpost and co-produce resources and remind me to show you a resource. We're creating this support group that we've talked about. And the other thing that they've also said is that the schools don't know what the issues are for these young people. And so what we've said, what we're going to do is, many of the issues are the same. So why not create an annual event where the schools can come to, recorded, and then if your child gets diagnosed in the middle of the year, you can share that particular recording with the school so they know what the issues are. And then if they need the nurses to go in, then that's what they can do. But this would be a better use of the nurses' resources rather than going to every school when that's not always needed. And then for the success at school, an association supported letter for extra exam time will be powerful and remind everybody. And you'll put that on the checklist as well to make sure that that doesn't get missed. One of the things that came up is outpatient time, waiting times. Oh, it's so long. Oh my God, what can we do? Well, the adults use a buzzer to call patients back. Not sure why we don't do that. And you guys may be wonderful and may already be doing that, which is fantastic. And then the other thing is, it's for the group, it's a communication in both directions to say, for the parents, what are the issues, what's frustrating, what's making your lives bad, so that we can actually feed that back to the groups nationally and actually try and find solutions and change practice to address that. And certainly I was invited to join the parent group. I know that they get frustrated, so they would rather bash, not often, but they'll need somewhere to vent their frustrations, which is fine. So I'm not going to join the group because I don't think that's right. But as long as we know what the issues are, we can then deal with them. But we can't deal with them if we don't know. But also share what's working well, so it spreads across the UK, and make sure that those with complex needs are not forgotten as well. And one of the resources, I'm going to just stop sharing my screen. Let me just make sure there's nothing after that. Yeah, no, forget that. So one of the resources that we did share, and I know that Heather, while I share this resource, you might want to There. Am I sharing?
Started.
Has it started?
Starting.
Starting. Okay. So this is just something that one pet patient, is it up?
Yeah.
Yeah. So this is a resource that we've actually we're putting up in the children's on the wards, and it's for parents by parents. And this was by the family therapy ran a group of patients about what their issues were. They were really struggling, and they said when they're first diagnosed, it would be really helpful to know this. You know, help yourself, be kind. But to the professionals, I often feel overwhelmed. I feel guilty and self-critical. Outwardly, I might look like I'm managing, but be kind to me and listen to me. And I got in contact with Heather, I wouldn't say Heather Featherlegs. That is not her last name, but that does not matter. We're going to call her Featherlegs because she's wonderful. Heather, are you there? She might not be there. Oh, that'd be a shame if she's not. But Heather said that it was really important for this two-way conversation. They've got 1,200 people on their database for patients with kidney disease, international as well. And she was beating her head. And this parent support group, she suddenly can see the light at the end of the tunnel saying, wow, this is fantastic. We can work together to make a difference for patients and young people across the UK. And it can also help improve our services. So that's all I'm going to say about this. And if anybody wants to chat, we're more than happy to chat, but only I'm conscious of time. But hopefully that's given you some ideas. There is no one way of doing it. You have to look at what works for you, and there will be different ways of moving forward. But it's thinking outside the box and thinking about how can we move this forward, and going from there. Questions, anyone?
Oh, and I can't see any questions in the chat box, but one of the things that has been actually just flagged is how helpful it was to hear directly from Stefan. So sincere thanks, you know, lots of comments there. And there's also a brilliant resource that's been signposted too that I've just been having a little look at, Turn to Us, which provides huge, you know, information about benefits, etc., that can be accessed. So, you know, if we can all be promoting that in our local units, that would be phenomenally helpful.
But sometimes it's overwhelming when they're looking at it and they just need support to navigate the system. So it's about trying to get those advocacy officers, and patients can often support patients to move forward. And that's wonderful as well. So it's using your patients and your parents and using them as peer supporters. And that'll be a really good way. And that'll be something that we'll be looking forward to doing. And we're going to hold these sessions every 2 months, but with the associations and across the UK. It's using your resources wisely. Yeah.